So Joe Biden has come out and said that his healthcare plan would cover 97% of all Americans, and he's basically bragging about that. He's saying it like it's a good thing. I mean, I made fun of John Hickenlooper because Hickenlooper brags that when he was governor of Colorado, or as governor of Colorado, he achieved near universal health coverage. Now, I want you to reflect on that for a second, because what that means is, fundamentally, you're bragging about not getting everybody covered. Just try to take yourself out of the context of the United States for a second and think if you're somebody living in any other developed country and you have a politician bragging, we have near universal coverage. So that means that plenty of people don't have coverage, which means those people are subject to medical bankruptcies. Those people are subject to, perhaps they can't go to the doctor at all because it's not easily accessible to them, and then a problem spirals out and gets way worse, and then they could die. So the idea of bragging about near universal coverage is, to me, both tragic and insanely comical. And this is what Joe Biden did. So he said 97% of all Americans would be covered by his plan. Now, his plan is basically an extension of Obamacare. It depends what day you catch him. Some days he says, it's just an extension of Obamacare. And the implication is you still have just bring back the individual mandate and make some other tweaks and then we're good. And then on his good days, he goes all the way to public option. So we go, slight tweaks around the edges, but we keep the for-profit health insurance companies in control, bring back the individual mandate. That's the bad days. The good days is, okay, public option. So he's all over the place, but that's the spectrum of what he says when he talks about his plan. But by saying 97% of all Americans would be covered, that means 3% wouldn't have coverage. Well, guess what? Common Dreams is reporting on a new study that was just released on his plan. Take a look. Not acceptable. Analysis estimates Biden healthcare plan would kill 125,000 people in first decade alone. As Biden vows to, quote, do everything in my power to defend system based on for-profit insurance industry, People's Policy Project shows death toll would be equivalent of 42 September 11 style attacks. So Matt Bruenig of the left-wing think tank, the People's Policy Project, said the following. One commonly used estimate states that one unnecessary death occurs annually for every 830 uninsured people. This means that during the first 10 years of BidenCare, over 125,000 unnecessary deaths will occur from uninsurance. Now, by the way, if you say, well, I don't know, I don't think I agree with that analysis because I'm more centrist. Okay, well, you know who does agree with this analysis and has used that one death for every 830 uninsured people? CAP, the Center for American Progress. Basically, the epicenter of centrist Democrat thought. So even they agree to that number, and all Matt Bruenig had to do was the math. Okay, let's see. How many people? 3% of the country uninsured. This is under his best case scenario, so we're using his best case scenario that he gave us. 3% uninsured. That's X number of people uninsured. You do the math on it and extrapolate out for 10 years, and we have 125,000 people dead in the first decade alone. See, this is the reality of what happens when you don't have a system which protects basic human dignity. You do have deaths as a result of it. You do have a broken, disgusting, rotting system. We haven't even gotten into cost. Obviously, under Biden's system, there would be a staggeringly high cost to medical care, and we would not catch up to the rest of the industrialized world. But putting cost aside, this is still, on its merits, incomprehensibly bad. And that's what's so offensive about centrist Democrats, corporate Democrats, is that really what they are is people who just want to slightly tweak the status quo in your favor. Okay, so fewer people would die under BidenCare versus the current system, but still 125,000 people die in the first decade. So that's not, you can't really form a coherent argument in favor of this position. You just can't do it. And even if you say, well, no, he's just taking into account real politics of how it functions, and he knows this is probably the best we could do, so that's all we're going to get. Well, no, as I've explained to you guys a million times, forget the policy. Even on the politics, Joe Biden and the other centrist Democrats are wrong. Because, if you've ever negotiated for a price to lease a car or purchase a car, you know the deal. You don't go in already agreeing with them. You don't go in already with a half measure. You rep your position. So for Democrats, what they should be doing is repping an NHS-style single-payer healthcare system. And then maybe you compromise all the way to a Canadian-style single-payer system. But he goes in up front with giant concessions because he actually believes in this centrist garbage, probably also because he takes a lot of money from a lot of rich people who leech off this system, for-profit health insurance companies and the like. But what you have to do is go in and say, my position is this left-wing position, the actual left-wing position, and fine, you want to negotiate? We meet on a Canadian-style single-payer system, but he's not doing that. He goes in hawking the Heritage Foundation plan, hawking a very centrist plan, and then he'll ultimately get bupkis. Remember, this is also the guy who says, oh, we need a president who can persuade people. You were in the White House with Obama. Did you not see that McConnell and his merry band of vicious dipshits had no interest in that? I mean, they were accusing him of being, certainly Donald Trump was, and many others, oh, Obama's not even American. He was born in Kenya. And they broke the filibuster record. And you think you're going to convince these people? I mean, honestly, that's bordering on delusional at this point. So, no, the way you break them politically, you have to fight them head on. Use the bully pulpit and the power of the people against them. And you use that to make your whole caucus fall in line, so even blue dog Democrats support a Medicare for all system. And you use that to fundamentally break maybe 2 or 3 Republicans who are from very blue states. So, but you have to use the bully pulpit. FDR knew how to do that. Even Lyndon B. Johnson, to an extent, knew how to do that. But every modern Democrat, Bill Clinton, Barack Obama, Hillary Clinton, Joe Biden, and the people who rep that neoliberal centrist philosophy, they don't know how to do that, or they really don't believe in those left-wing positions. So they go into it shooting themselves in the foot up front. And I think it's both. I think they don't want those left-wing positions anyway. But also, even if they did, they wouldn't know how to get them by doing the proper strategy. So anyway, 125,000 deaths. So I just want everybody to understand, if you support Joe Biden in the primary, this is what you're signing on to. It's a package deal. You can't say, well, I support Biden, but I'm not cool with 125,000 deaths over 10 years because of his shitty healthcare plan. Even giving him best case scenario with his own numbers. But you need to digest that. You need to understand that, because this is the reality. Supporting Biden means supporting 125,000 deaths over a decade from lack of healthcare.